Good afternoon, everyone, and welcome to the Improvement and Innovation Showcase on Workforce Sustainability, Building the Future of Healthcare. My name's Isla White, and I'm the Strategic Lead for Workplace Wellbeing Partnerships at the CEIH, and it's my pleasure to be hosting the session today. I'd like to start by acknowledging that CEIH is based on the traditional lands of the Kaurna people and that we pay our respects to the spiritual relationship with their country. We also acknowledge the Kaurna people as the custodians of the Adelaide region and that their cultural and heritage beliefs are still as important to the living Kaurna people today. I'd also like to acknowledge the other lands that people might be joining us from today. So before we start, just a bit of housekeeping. So this session has been preset to keep your mics on mute and the video feed turned off by default, so your camera's off by default. However, this will be enabled during the Q&A time after today's presentation, and only the presentation will be recorded and published. The recording will be stopped for question time, so please engage with us via the Q&A function or use your mics or the chat function to ask your question, and please turn on your cameras because we'd love to see your faces at that point. Finally, before the Q&A, there will be a quick survey or poll for you to complete, so we'd really appreciate you taking a few minutes to complete this before we launch the Q&A. So for those of you that are unfamiliar with the Commission on Excellence and Innovation in Health, or the CEIH for short, we're the lead agency for innovation in healthcare in South Australia. And we love bringing together consumers, clinicians and other collaborators together to turn ideas into better healthcare. So our vision is together creating health and prosperity for all. And to do this, we're supporting the sector to come together to imagine new ideas for better healthcare. We also acknowledge that better isn't always excellent, but we're committed to measuring what we're doing so we can understand the impact that change is having. So what if the big idea was actually connecting all the small ideas? And this is the essence of why we host the Improvement and Innovation Showcase. So help to connect people in SA and across the sector, providing a space to explore what others have learned. So today is all about sharing ideas, improvements and innovation. During the series, sessions are approximately 40 minutes and will be made available online following the series. And we aim to keep it simple and share work happening across the sector at any stage or level of success, so not just waiting until work is complete and ready to be published. We generally try and focus on work in South Australia, but every now and again we will share a showcase outside our state to ignite new ideas for us. Just a quick prompt or a plug. So if you have a problem or you've had success solving a problem, or whether you've learned something you're trying to do, or you have something you'd like to see explored, please get in touch with us via the email on the screen. We'd love to hear from you and help shape future showcases. So now I'd like to introduce the theme of our 17th series that we're in at the moment, which is Workforce Sustainability, Building the Future of Healthcare. This is a particularly important topic for us at the CEIH, and as such forms one of our core strategic directions. We're committed to putting people at the centre of everything we do, and our workforce is the cornerstone of our healthcare system. Our system relies on a strong and sustainable workforce to deliver safe, high-quality care. So supporting our workforce is not just critical, it should be foundational to everything we do as a system. However, in saying that, workforce sustainability is very multifaceted and it's complex. So we must start thinking differently if we're to keep up with the predicted workforce shortages and increasing demands across our healthcare system. We could have easily included way more than 4 sessions on this topic, given the breadth of what drives workforce sustainability and the range of initiatives, great initiatives that are underway across our state. But we've been excited to showcase 4 episodes across the system, which we're now up to episode 3, and they've all been approaching workforce sustainability from a different angle, from work design, redesign to models of care, today looking at recruitment pipelines through to embracing our intergenerational workforce, which is coming up next week. So if you haven't registered for our final episode, we encourage you to click and register on our website or on the screen. So now it's my absolute pleasure to introduce our speakers of today. So we've got Adjunct Associate Professor Louise McGuire, who's the Director of Nursing and Midwifery Professional Practice at Northern Adelaide Local Health Network. Louise is an experienced nursing leader, currently serving as the Director of Nursing and Midwifery at NALHN. With over 30 years in clinical and senior leadership roles, Louise specialises in workforce development with a passion for person-centred practice and nursing and midwifery research. She has a strong track record of leading large teams, implementing innovative models of care, and driving recruitment and retention strategies across complex health services. Louise holds a Master of Clinical Science in Research and is currently completing an MBA, underscoring her commitment to combining clinical excellence with strategic leadership. Vicki Nagy is the Talent Acquisition Specialist at NALHN. She has worked in health for over 40 years, including 30 years in people and culture across roles like senior HR consultant and senior project roles. Vicki is passionate about creating positive workplace experiences where staff feel valued and supported, and focusing on helping people thrive throughout their work journey and promoting NALHN as an employer of choice. I will now hand over to our lovely speakers.
Good afternoon, everyone, and thank you so much to the CIH for having us here. It's a real privilege for Vicki and I to be here today. Thank you, Isla, for the introduction. So, as Isla said, I'm the Director of Nursing Midwifery here at NALHN of Professional Practice, and I'm really grateful to be able to present today with our fabulous Acting Director of Organisational Capability, Vicki Nagy. Next slide, please, Vicki. I'd also like to acknowledge the Kaurna people and the lands that we work on today. So Northern Adelaide Local Health Network, Lutapinti, Kaurna, Miyana, Yata Matanya, Gara, Yatara, Ara Naglu, Waposinli, Naglu Tapinti, Pukana, Pukanku, Yalaka Taika, Naglu Tapinti, Yata Matanya, Kuma, Panaku, Tula Yatanka. And NALHN recognises the Kaurna people as the traditional custodians of the land where we proudly work to deliver health and wellbeing services. We also honour Kaurna elders past, present and emerging. We recognise Aboriginal cultural authority and their ongoing spiritual connection to country. Thanks, Vicki. So we're really excited to be here, and we're really grateful for the opportunity to speak with you today. At NALHN, our values guide everything that we do. Our values are everyone has a story, everyone contributes, everyone matters, and everyone grows. And these really just aren't words on a page for us. They reflect the essence of true person-centred practice. They shape how we care for our consumers, how we collaborate with our partners, and importantly, how we value and support our people. So today we'd like to share how we're applying this person-centred approach to workforce retention and recruitment. Because as you know, like many parts of the system, we face increasing pressures, but we also see enormous opportunity in rethinking how we understand and respond to the needs, motivations and experiences of our staff and the community. I'll hand over to Vicki to talk to you now about the LHN demographics, workforce and strategies that are being implemented to retain and attract our workforce as our footprint at NALHN continues to grow. I will then go on to speak specifically around the nursing midwifery journey. Thanks, Vicki.
Thanks, Louise. It's really important here in NALHN that we link with our local communities as we build our workforce of the future. Our local community is where our staff live and raise their families, and we really need to stay in touch with them to ensure that the person-centred approach that we're building is exactly what our northern population needs. So just to give you a bit of an idea of what our northern population looks like, I've just provided a few demographics, some really broad demographics around our northern area. So we have nearly 500,000 people in our catchment area, with one of the country's highest population growth rates. Our demographic age shows that by 2040, our ageing population of those people over 65 is going to increase by almost 3%. Our population has a higher prevalence of high-risk factors than anywhere else in the state, including obesity, dietary inadequacies, increased alcohol consumption with little or no exercise, and high or very high psychological distress. This all adds up to a really challenging and high acuity of the community using our services. And we need to make sure that we can support our staff to be able to provide safe and efficient services into the future. So in saying that, what services do we provide? So we provide services across 2 major hospitals. So we've got Louise McGuire and Nagy Hospital, and both of those hospitals have a critical care, women's health, paediatric health, surgical services and general medicine. We also have community-based services where we have Aboriginal healthcare services and wellbeing support, general practice and specialist clinics, as well as community and hospital-based allied and mental health services. I'm going to take an opportunity to also tell you a little bit about our workforce. So in order to us to have a person-centred workforce and to plan for our future, we need to understand what our workforce looks like now so that we can plan to see what it's going to look like in the future. So NALHN accounts for almost 6% of the total of the South Australian public sector, and 53% of our workforce are part-time. Almost 60% of them are ongoing employees, and at least 23% of our staff have between 10 and 20 years service in the public sector. And almost 50% are mid-career, so are aged between 30 and 54 years old. Nursing and midwifery are our largest part of our workforce with 55%, followed by our medical workforce at 16%. And then administration is our third largest at 13% of our workforce, and allied health our fourth largest at 11% of our workforce. How do we find all of these people? Well, health is a growing industry and we advertise for new and replacements at the rate of around 15 roles per week. So far this year in 2025, NALHN's advertised more than 950 jobs, including more than 330 nursing and midwifery jobs alone. We've had a total number of applications of more than 19,000 and just nursing applications of over 8,500 roles. So we all know that we've got lots of challenges moving forward and that we will need to use both attraction and retention strategies to ensure that we have the right skills in place to provide health services of the future. AI is going to become even more important as we move forward, and it will have significant impact on how we provide services and by whom in the future. There's a significant shortage of skilled health professionals that have experience, and it was identified during COVID how vulnerable our health workforce really is. And we know that our professionals are choosing to leave the workforce and move into different careers. Identification of a person-centred approach is going to become important, and that will focus on caring for our people by recognising them as individuals with unique strengths and respecting their values and needs as to improve staff wellbeing and enhance job satisfaction and ultimately increase retention by making us an employer of choice. So we can have the best facilities, best intent, but we need to recognise that it's our workforce that will make all the difference in the experience and outcomes for our patients and consumers. Our workforce provides exceptional services that we strive for to be able to create the workforce of the future. And we need to be creative and more agile where we look at how we recruit people. We've attended lots of expos in the past to showcase careers in healthcare and provide information about how people can find us and apply for our roles. And also we always bring clinicians so that clinicians can actually talk to young people about first-hand advice about what a job career might look like in health. This forms the basis of our long-term strategies to attract young people in the north to careers and to assist them to find pathways and support them to transition from school into education, and then finally assist them with the long-term healthcare vacancies of the future. It's a very long-term strategy that we hope will bring lots of new people to us, but perhaps not for another 5 to 10 years. So our person-centred practice seeks to strengthen our workforce culture and make staff feel valued and appreciated. Our service recognition program was launched in 2024, and that program developed from staff feedback during the People Matters Employee Survey in 2023. We've provided pins and certificates to more than 2,500 NALHN staff in the last 2 years, and all of our staff have given us lots of feedback about how wonderful that they've found the program. This year in 2025, we saw our first NALHN-led leadership program, where the program feedback has been overwhelmingly positive, and we will increase to 2 training programs in 2026. This program seeks to really move our managers to leaders and to focus on ensuring that our teams are performing at their peak. We're reviewing our recruitment and selection techniques to ensure that we're accessible, supportive and fair for all candidates, including those that identify as neurodivergent, by exploring how we can offer more flexible interview options, including quiet spaces and allowing support people to attend. By using our exit information, we can see why people are leaving us, and we're using that to inform our person-centred strategies of the future. One of our strategies that we've just implemented in NALHN is Flourish, and Flourish is a app-based psychological health and safety workplace for our staff. It's a digital program, and it's designed to support by providing practical skills, resources and learning opportunities to help us all thrive. And it's now available to all NALHN staff, and it has a range of opportunities, including mental health awareness videos, relaxation, self-help tools, positive psychology-based surveys, interactive mental fitness chatbot, which is a virtual coach to guide people through mental fitness strategies, which is a wonderful for our staff to use. So just looking at some of our recruitment strategies now. So as I said before, we're using a very long-term approach in NALHN. So we're looking at kids that are still at school. So we're looking at children in Year 9. So and we note that we are the largest employer in the North, and that we do have lots of unemployment in our community, and we know that that has a huge impact on health outcomes. We have days where we have up to 400 students attend LALMAC. They see firsthand how hospital works, and that's from the kitchen to linen supplies, also to spending time with clinicians and engaging in activities that showcase health careers. We will be also expanding that to Modbury Hospital for next year, where they will have a career day where they'll also be invited into the hospital to hear clinicians talk. And that will give further exposure to another 300 Year 9 students. We're working on having a presence at multiple career expos to ensure that we are visible in our local community, so that our local community know who we are and that can identify us, and also that the kids know that they can ask us questions about how to have a health career. We're also running a traineeship program, and I'm really excited. It's one of my little pet projects. I'm really excited by that, as being the only traineeship program at the moment in SA Health, and we're running it as a host employer. So NALHN will actually be a host employer, and we're running it in partnership with a private company. That will start small for next year, and we'll only have 7 trainees next year, but we hope that the program will grow and that will become a pathway for our admin staff of the future. We're also running a work experience program, so that should start also again in 2026. We know that for Year 10 students, work experience is a bit different these days, and it's not the standard 1 week. So we are looking at ways in which we can support students to have placements that are more scattered across times. We will re-establish the program, and we've been able to talk to vet teachers and other education staffs about how we can support students to write good applications and how they can have pathways into health careers. We're working with Department of Education around SACE 1 courses, and those SACE 1 courses are really going to be tailored to Years 10 and 11 for a whole of health approach, where students can choose to branch out into areas of interest. And it's really an entry level for students to think about health careers and tertiary degrees. This is really important for the kids in the North, because often they don't have somebody in their family that can help them breach that gap from high school to university, because they don't even know how the pathway works or how that pathway might happen. We also have a number of medical programs that are running at the moment. We know that our students in our schools often may want to become a doctor, but really don't know how to, and the chances of them being able to apply for and being being actually admitted to medical school is really low. So in partnership with the Adelaide Uni, the medical team at NALHN are trialling a number of programs to increase medical students' intakes from northern schools, which includes supporting Year 12 students with gatherings, with developmental sessions, with homework sessions, and hands-on support and practical guidance for them to be able to apply to medical school. That's just a snapshot of some of the really big pieces of work that we're doing in NALHN, and for us to really try to push forward, I guess, with our recruitment strategies and retention strategies of the future. I'm going to hand back over to Louise now, who's going to talk more specifically about retention and recruitment and a person-centred approach in nursing and midwifery.
Thanks, Vicki. That was fantastic. A hard act to follow. Next slide, please. So I've been working at NALHN for probably about 2.5 years, and when I came here, like everybody, it was experiencing a significant workforce shortage. And so we were having conversations around, what can we do in that space? We know it's an international problem, but what can we do? And what can we do that's in alignment with the NALHN values that I discussed earlier? So I guess what we needed to think about was, instead of just thinking that we're going to roll out some strategies, what we need to know is actually what are the workforce saying. We knew that that was not long post-COVID, that nurses and midwives, everybody, but nurses and midwives were struggling. So we need to hear from them, because what we know is that for every person we lose is $35,000 a person to replace, not even talking about the quality and safety impact of losing a skilled workforce. So what we did was introduce Well Cafes. So across the organisation, from students to level 6 nurses and midwives, we've had what we call Well Cafes. So basically it's where people come along from every level to have a conversation about what's working and what's not. So just to hear from them genuinely and care about what they have to say. And so what you do is you move from table to table and you give feedback, and then you build on the feedback each time. So it's actually a lovely thing to do, because staff really enjoy it. They love getting together. So even the networking piece was really rewarding for people. And so what we did from that was take that feedback and theme it. So the initial feedback we did when I first did those Well Cafes. In addition to that, we had some fabulous values-based research that Professor Lynette Cusack had undertaken with regards to enablers and barriers to quality care. And then I had the privilege to go overseas with the Premier Scholarship to look at retention and recruitment strategies within the States and in the UK. Next slide, please, Vicki. So what did people tell us? So what people told us was that they were struggling with feeling kind of burnt out, tired, not surprising, but real for people, that they felt that there wasn't time to care for their patients. That's what they got into nursing and midwifery, and they didn't feel that they had the time in that space or the focus on quality care. That from a professional development point of view, they felt like we could do better. So there was a lot of really fantastic feedback. Quality care, the level 3 role being quite overwhelming. And so what you can't do when you get all this feedback is then go, oh, well, that's great, I've got it, tick that box. You have to do something with it. So then that's what we did. So we themed the data, and then we looked at what strategies we could put in place, because what we really wanted to do was keep our people. They're good people, right? They're fantastic nurses, and we know that a skilled workforce is really hard to come by. So if we keep our people, then that will attract other people as well. So we implemented, in relation to what they talked about in terms of feeling exhausted and overwhelmed, compassion labs. So we worked with the Compassion Revolution and Mary Freer and her team, and brought in compassion labs for our level 5s and 6s across the organisation, because what we were hearing was that the staff on the floor needed to feel cared for. So we needed all levels of management to look at caring for themselves, because we know that if our cup isn't filled, then we can't care for other people, right? So whether that is staff you're caring for, or the patients on the floor, or the women that we care for. So really important that we care for the people that work with us. So we had Compassion Labs. We've rolled it out for all level 5s, level 3s. We've now just completed a Train the Trainer program. So our fabulous Train the Trainers are now holding Compassion Labs for our level 1s and 2s and enrolled nurses. So that's so exciting, and people come back just feeling really cared for. It's really the only, if you think about it, education session where people go and it's all about them, not about what skill they're going to learn, etc. So they feel really like NALHN values them in terms of our executive value, everybody around them values. So it's been really successful. The other thing we heard was that people were feeling unsupported because we know that we've got 40% of our workforce are less than 4 years. So how do we support new staff, early career? And we implemented a mentoring program. We also implemented the NMO implemented clinical practice mentors, and we've continued that on here this year. We're very grateful for that initiative. And then we heard professional development was really important for people, that they felt like they weren't being encouraged to grow. So we've developed novice to expert pathways in every area across the organisation so that people can see how they can get to the next level. So it's very practically based. Then the quality care element was really important to people. You know, people know what quality care is. They're not doing, you know, fundamentals of care because they don't know what it is. It's because there's other barriers in the way. So let's help them with that. So then I was introduced to person-centred practice, different from patient-centred practice, through Karen Dakiri, who's a Director of Nursing in Sydney Prince of Wales Hospital. And really that was about how do we both care for staff and patients with the Brenda McCormack and Tanya McCants framework. Next slide, please, Vicki. So this is person-centred practice. Was really exciting because what I always felt was that if staff feel valued and cared for, they would do anything for you, right? They work harder, or not harder, but they come to work and they do great work. And when people feel valued and they professionally develop, then their patients and the women get even better care. And this evidence from McCormack and McCants clearly indicated that, both with caring for patients and staff. So we've had person-centred practice rolled out or implemented within our level 5 and 6 nurses and midwives, and then we have conducted workshops for our level 2s and 3s across the organisation, and every ward and unit have now developed their own vision statement. You can see cardiology is there, which is just beautiful. And then what you see there is the lecture theatre where the staff who have been through person-centred practice work with each of their areas on their vision statement, their ways of working, and what their safety and quality priorities are. So they go away, come back and present to us, and this is one of the presentations, and we have big signs where we go, yay, great job, great job. And we've seen a tremendous shift across the organisation in terms of the vibe, that people are excited that we're focusing and caring for them, and also about the patients and the importance of getting our focus, which has always been, but enhancing our focus on quality care. Next slide, please, Vicki. I've got to talk quicker, I think. Other things that we're doing, lots of exciting things. So the Clinical Collaborative, which is where NALHN was a pilot site with York and Northern Barossa Hills Fluorio, to have students who live in the north, study in the north, do all their placements here at Modbury and the Lyell McEwen. And then the view too that it looks after them as people and their families, but also it then enables them to become an AIN here, and then go through and have a TLP here, and then we have permanent contracts for TLPs here in the north. So that's been an amazing strategy. Having students that do all their placements with us, if they choose to do that, has been amazing, because as we know, our staff feel a bit overwhelmed by teaching people and have the early career workforce also that they're trying to support. So having people who come back repeatedly that you don't have to reorientate multiple times has been, the staff really love it, because they feel like they're invested in those students, because they're going to become a NALHN staff member. So that's been really a win in both areas. We've also been involved in a Year 12 Northern Adelaide Secondary School Alliance integrated learning subject. So that is where this fabulous teacher from Parafield Gardens, Matt Carter, reached out to me to say he wanted to develop a Year 12 subject, nursing midwifery subject. I'm like, oh, okay, that sounds interesting. And I then reached out to my fabulous Uni of Adelaide and Uni SA colleagues to say, can you help me here? Of which they did. I'm really grateful for. So we worked together to develop a Year 12 subject at Parafield Gardens, and they had an amazing retention rate in that subject, and 24 out of the 26 finished the subject, which was unusual, and then 60% have gone on to health careers. But what it involved from our perspective was we had mentors, nursing midwifery mentors, and I'm so grateful to the fabulous team that I work here with in education. And we would go to the school 4 times a year and help them with, like, we did a communications task or assignment. We did a presentation. I had to learn quickly about snake bites again, hadn't done that in a while. So we helped them with their subjects and their assignments, but also help them understand, what does a nurse do? What does a midwife do? And is that something that I could do? And we would be like, you absolutely can do that. And often, like Vicki said, they hadn't considered that they could do that. So it was really giving that exposure. I'm really excited to say that that's grown to 3 schools this year, and we're now in Craigmore, Salisbury, and in Parafield Gardens. Next year we're going to have 4 classes that will be involved. But I have to say, the staff here, whilst doing in their time within our working day, it fills their cup significantly. It's been an amazing experience, and the people we've been involved with. We also have been doing resilience-based clinical supervision as a pilot in one of our units for level 3s, being supported through supervision, which has been a really successful, and we're looking at whether we potentially could look at expanding that. We're going to be involved with the NMO and other LHNs, I think Women's and Children's and York and Northern and Mount Gambier, around a statewide rostering project, because one of the things we heard loud and clear in our World Cafes is that people need flexibility in their rostering, and because it's their market right now, they can go wherever they like. They will go if they don't, if we don't help them to meet their needs of their family and their work-life balance. Another strategy that we're about to put in place that we've just developed is a clinical research pathway, because what we heard in the professional development feedback is that there's no pathway for research really in nursing and midwifery unless you want to go to university and work in the universities, or there's the very few joint appointment positions, or there's a couple of director of research positions. But this enables, and you won't be able to really see there, but the plan is over the next 5 years to have a level 3 in each division, who's level 3 or 4, whose sole role is research. That they could work clinically as well, but that's the focus of them. And it's really about building level 2s, 3s, 4s, 5s up through a clinical research pathway. Next slide, please. That's lots of words. I'm sorry, I spoke very quickly. So in conclusion, I think it's really important that we shift solely from recruitment, because that's what we were talking about all the time when I first arrived, like how do we get more people in? But actually there's no point in getting more people in if you don't retain them. So the work to help our staff to feel valued has been key. And really that focus on creating healthful cultures. We know that people who feel valued and supported to grow will stay in an organisation. There's lots of research about that, and we really want to focus on that. We know that if we optimise staff experience and wellbeing at work, they will also stay. And I think we need to think differently about how we attract and retain candidates, so how we align values and have a person-centred focus. We know, as Vicki's talked about as well, that we need to grow our own workforce from our local communities. We have a responsibility here in the North, and we can make a tremendous impact being the biggest employer in the North. And how exciting to have people caring for members of their own community, not just in nursing, midwifery and medicine, allied health, in the kitchen, in the corporate, wherever. It's really fabulous. But overall, when we get the work around retention and recruitment of our workforce correctly, the impact is for our community, right? My real and Vicki's real and the organisation's real passion is that we know that well people deliver care well. Thank you. Thank you for your time today.